Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Protriptyline. Its brand name is Vivactil. And before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So Protriptyline is classified as a tricyclic antidepressant. In terms of indications for use, as I just kind of mentioned there, it is indicated to be used in the treatment of depression. Now, before somebody was to use Protriptyline, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. This medication cannot be used by patients who are in the acute recovery phase following a myocardial infarction or heart attack. This medication also cannot be used within 14 days of a monoamine oxidase inhibitor. And if a patient had a hypersensitivity to Protriptyline or any other component of the product, they would not be able to use this medication. Now, in terms of precautions, this medication is on the Beers criteria, which is a list of medication that the elderly population should either avoid or use cautiously. We would want to avoid using this medication in the elderly population due to the anticholinergic side effects, the risk of sedation, and as well the risk of orthostatic hypotension, or a sudden drop in blood pressure when going from a seated to a standing position. We would also want to avoid giving this medication to elderly patients who have a history of falls or fractures. Monitoring is recommended when patients use this medication who have cardiovascular disorders. Arrhythmias and conduction delay may occur with the use of Protriptyline. Patients may be at an increased risk of experiencing a myocardial infarction or heart attack while using this medication. Both an increase and decrease in blood sugar levels have been reported in patients using Protriptyline. We would want to use this medication cautiously in patients who have a history of seizures. When patients are starting this medication, bipolar disorder must be ruled out, as using this medication may put these patients at an increased risk of experiencing a mixed or manic episode. And lastly, this medication should be discontinued if possible a few days prior to a surgery. Now, once somebody is cleared of the contraindications and made aware of the precautions and warnings, and they start to use Protriptyline, they can expect to receive their dose orally. So if somebody is using Protriptyline to treat depression, they would typically start off with 15 to 40 milligrams per day, given in 3 or 4 divided doses. And the dose may be increased to a maximum of 60 milligrams daily, again given in divided doses. For maintenance therapy, the dose should be reduced to the smallest possible dose that still provides symptom relief. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using Protriptyline, so I'll go over some of those here now. Some patients may experience hypotension or low blood pressure, and some patients may also experience tachycardia or a rapid heart rate. Constipation and dry mouth are possibilities with Protriptyline. Some patients may experience dizziness or somnolence, and blurred vision may occur in patients as well. Some more rare but serious side effects would be a myocardial infarction or heart attack, a granulocytosis, worsening of depression, or suicidal thoughts. That's all we're going to talk about today with Protriptyline. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.